In 1854, a quiet summer descended upon Chicago, but the air was thick with a deadly secret. Over 5,000 lives were lost that season, not to fire, war, or famine, but to the very water they drank. Across the nation, New York buried its cholera victims in mass grave. Memphis, reeling from yellow fever, saw 10% of its population vanish. These were the largest, wealthiest cities in America, yet they were killing their own residents. Little did they know, the water flowing from public pumps and city pipes harbored an unseen menace. Something no doctor could detect, no politician could perceive. This is the harrowing tale of how America's cities became death traps and the courageous few who dared to save them. Philadelphia, 1830. The air carries a rancid odor, not an exaggeration, but a grim reality. Walking the streets, the stench hits first, a noxious mix of human waste and animal carcasses. Open gutters meander alongside cobblestone roads, directing filth toward the Schuylkill River, the city's primary source of drinking water. By the time it reaches the taps, it has absorbed the sewage of tens of... Yet Philadelphia was not the worst. In New York, the Collect Pond, once a pristine freshwater source, had become a toxic dumping ground for tanneries, slaughterhouses, and breweries. By the early 1800s, the water had turned black. The city filled it in and built a neighborhood atop this grave, giving birth to the 5 Points, known for its violence and disease. For decades, the ground oozed sewage, a silent reminder. Chicago, however, had perhaps the most absurd setup of all. The city drew its drinking water from Lake Michigan, an idea that seemed reasonable until one realized that it also dumped its sewage into the Chicago River, which flowed straight into that same lake. The city was in a grotesque loop, drinking its own waste, yet the authorities appeared unconcerned. Visitors described the water near the intake pipes as brown and barnyard-smelling. The same pattern repeated across the nation, where towns along the Ohio River faced the same fate. What one city flushed, this was the grim reality of American cities in the 19th century. Populations surged dramatically. Between 1850 and 1900, New York's populace leaped from around 500,000 to nearly 3.5 million. Chicago burgeoned from under 30,000 to over 1.7 million. People flocked to these urban centers, seeking jobs and prosperity, yet the cities lacked the infrastructure to support them. Families relied on backyard privies, open pits that overflowed, contaminating in densely populated neighborhoods, dozens of privies crowded near a single drinking water well. A New York health inspector observed a tenement block where 80 families shared 4 overflowing outhouses, all while depending on one well for drinking water. The medical community found itself baffled, unable to unravel the cause of the rampant sickness and death. The prevailing theory was miasma, the idea that diseases emanated from foul air. Doctors suggested fresh air and herbs, while city officials focused on removing visible filth. The real culprits were microscopic organisms swimming in every glass of water, every well, every public fountain. Germ theory had yet to gain traction in America, and in the meantime, people continued to drink, and the death toll climbed. Funeral bells tolled relentlessly across Philadelphia and New York, but the cities remained deaf to the warnings. For a time, the rhythm of death in these cities seemed almost predictable. Winters brought a semblance of calm, spring ushered in renewal, and summer arrived with a vengeance. The cholera epidemic of 1832 struck New York like a freight train, a disease that had already ravaged Europe and Asia. When it reached the American shores, it exploited cities designed to facilitate its spread. Over 3,500 souls perished in New York alone, from June to, with a population of roughly 250,000 at the time. That meant 1 in every 70 New Yorkers succumbed to cholera in a single summer. Chaos ensued as wealthy residents fled to the countryside. Those who remained closed their windows and burned tar in the streets, convinced the smoke would purify the air. City officials set up quarantine hospitals, but they were overwhelmed within days. The medical community had no effective treatments, and death carts rolled through lower Manhattan. Cholera was a merciless affliction, attacking the intestines with extreme dehydration. Victims could lose gallons of fluid in mere hours, their skin turning blue, muscles cramping painfully. A person could wake up feeling fine and be dead by nightfall. In crowded tenements, families of 8 shared small rooms without ventilation or clean water, allowing the disease to spread like wild. Amid this chaos, a twist of fate unfolded. While American doctors clung to the notion of bad air, a London physician, Dr. John Snow, was quietly making groundbreaking discoveries. In 1854, he mapped cholera deaths across Soho, pinpointing a single contaminated water pump on Broad Street. By removing its handle, he halted the outbreak. Though he lacked a full understanding of bacteria, he demonstrated that cholera spread through water, yet his findings faced skepticism. The miasma theory was so entrenched that Snow's waterborne hypothesis was dismissed by many in the British medical community during his lifetime. In America, resistance was even stronger. Most American doctors ignored Snow's work, and the thought of invisible organisms in water causing death seemed absurd. Even after Louis Pasteur and Robert Koch proved the existence of germs, public health. Koch identified the cholera bacterium in 1884, revealing the terrifying truth behind contaminated water. Yet, cities continued to dump sewage into the same rivers they drank from, unwilling to invest in the expensive reconstruction of infrastructure. The typhoid fever emerged as a constant, silent killer, lurking beneath the more sensational cholera outbreaks. Unlike cholera, which came in waves, typhoid infected year-round, its symptoms developing slowly, leaving victims unaware until it was too late. During the 1880s and 90s, American cities reported typhoid death rates of 30 to 50 per 100,000 annually. Pittsburgh's water supply, tainted by upstream contamination, saw rates soar to over 100 per 100,000. Consider the gravity of this. Tens of thousands of Americans succumbed to a preventable disease, all due to a solvable problem, yet those in power failed to connect the dots. Memphis, Tennessee faced an even graver fate. In 1878, a yellow fever epidemic swept through, claiming over 5,000 lives. The population of around 33,000 dwindled to fewer than 20,000. Streets stood empty, doors swung open. The city's tax base collapsed, and its government declared bankruptcy, even surrendering its city charter. Memphis ceased to function as a city for over a decade. The divide between classes intensified. Wealthy families could escape to cleaner neighborhoods, while the poor and immigrants crowded into tenements, drawing the most contaminated water. In the 1832 cholera epidemic, the death rate in the 5-point slum was more than 5 times higher than in wealthier. For the impoverished of 1800s America, their very water supply was a lethal threat, and those who held the power to remedy the situation remained indifferent. This was only round one in a battle that would shape the fate of urban. A small group of engineers prepares to challenge the tide of death and disease sweeping through American cities. While communities bury their dead and debate the cause of illness, these pioneers embark on a decades-long battle that will cost millions yet save countless lives. more than any medical breakthrough. In 1855, Chicago hires civil engineer Ellis Chesbrough to tackle the city's sewage disaster. Observing the flat, marshy landscape, Chesbrough realizes conventional underground sewers won't work. Instead, he devises an audacious plan: lift the entire city, buildings, streets, sidewalks, up to 10 feet high on wooden supports. This allows sewage to flow downhill through newly constructed drains. Workers labor tirelessly, using hundreds of jack screws to hoist multi-story brick structures, while shoppers carry on, blissfully unaware. Yet, this is just the beginning of the outrage. Even after the sewers are built, waste still pours into the Chicago River, contaminating Lake Michigan, where the city draws. Chesbrough's next move is bold. He proposes extending the water intake 2 miles into the lake through a vast underwater tunnel, hoping to access cleaner water. The project takes years, claims lives, and when completed, the water quality improves only slightly. The sewage plume continues to spread, forcing the city to reverse the flow of the Chicago River with an extensive canal system. Downstream towns along the Illinois River are less than pleased, but for Chicago, typhoid rates plummet almost overnight. The real question lingers: what are the cities that cannot simply reverse a river? The answer emerges from a water treatment facility in Jersey City, New Jersey. Dr. John Leal, a physician well-versed in waterborne diseases, discovers that chlorine in small doses can eradicate cholera and typhoid bacteria. Amid a fierce legal battle over a contaminated water supply, Jersey City is ordered to construct a filtration plant. Instead of waiting, Leal makes a radical decision. He adds chlorine to the entire city's water supply without public knowledge. Unbeknownst to residents, a private physician has dosed the drinking water of an entire city with a chemical disinfectant. When the water flows cleaner than ever, the results are immediate and staggering. Typhoid cases plummet to near zero. During the ensuing court case, Leal's attorneys present the data, and the judge rules that chlorination is both safe and effective. This moment opens the floodgates, leading cities across America to chlorinate their water supplies within a decade. By 1920, most major cities have implemented some form of chlorine treatment, an intervention that seems minor, yet it becomes the most significant public health measure in American history. Meanwhile, Philadelphia opts for a different route. The city invests in slow sand filtration, a method imported from Europe, where water passes through layers of sand and gravel that capture bacteria and sediment. By 1906, Philadelphia's filtration plant at Torresdale is operational, reducing the city's previously horrendous typhoid death rate by over 80% in just 5 years. Yet not everyone supports this initiative. Politicians fiercely debate the cost. Building water treatment infrastructure is expensive. The multi-million-dollar filtration system raises eyebrows, and taxpayers question why they should finance a project with invisible benefits. Aldermen argue funds should be allocated to roads and police, while public health experts struggle to convey that unseen bacteria in the water. As chlorination spreads, fear grows. Sensational headlines in newspapers heighten public anxiety. Some citizens refuse to drink tap water for months, opting for potentially more contaminated private wells. Doctors and engineers work tirelessly to convince the public that the minuscule amount of chlorine is safe, and it's the reason their children have stopped. But the numbers speak for themselves. Between 1900 and 1936, typhoid death rates in cities with treated water drop by over 90%. In some areas, the decline reaches 99%. Cleveland transforms from one of the country's highest typhoid rates to nearly zero within a decade of introducing filtration. Pittsburgh's average of over 100 typhoid deaths per 100,000 residents in the 1890s dwindles to single digits by 1920. Economists and public health researchers spend decades attempting to quantify clean water's contribution to the decline in mortality rates. A prominent Harvard study estimates that clean water accounts for almost half of the total reduction in mortality across major American cities during this period. For infants and children, the impact is even more pronounced. Clean water emerges as the key factor in saving American children. Remarkably, clean water infrastructure extends American lifespans more than antibiotics, modern surgery, or any single medical advancement of the 20th century. Penicillin receives accolades in history books. Vaccines inspire Hollywood films. Yet, the lifeline of pipes and treatment plants hidden beneath urban streets saves more lives than all those celebrated breakthroughs combined. Between 1910 and 1960, American water infrastructure experiences a golden age. Cities invest billions in treatment plants, distribution networks, reservoirs, and laboratories. The Army Corps of Engineers constructs vast dam and aqueduct systems, channeling clean water hundreds of miles. Los Angeles builds an aqueduct over 200 miles long, slicing through mountains and traversing deserts to supply the city with snowmelt. New York's Catskill Aqueduct delivers water from upstate reservoirs to Manhattan, operating solely by gravity over the final 92 miles. Chicago constructs water intake cribs miles offshore in Lake Michigan, linked to the city by tunnels bored through solid rock beneath the lake bed. These monumental engineering feats rival the Panama Canal in ambition and cost. Clean, safe drinking water becomes an expectation when Americans turn on their faucets. For families, the difference is profound. In 1880, a family in cities like Pittsburgh or Chicago could expect to lose at least one child to waterborne disease before age 5. By 1940, childhood deaths from contaminated water have become exceedingly rare in cities. With modern treatment, mothers no longer boil every drop before giving it to their children. Summers cease to evoke dread. The fear that haunted urban life for a century dissipates, replaced by an unprecedented trust in the water supply. Yet this trust becomes a double-edged. As generations pass, the memory of cholera and typhoid fades. Children and grandchildren grow up turning on faucets without a second thought. The underground pipes fade from view, the treatment plants become mere background noise, and budgets for maintenance become easy targets for politicians. For decades, American water infrastructure quietly hums beneath city streets as the nation's focus shifts to highways, airports, and the space race. Unbeknownst to the public, the clock is ticking down. The infrastructure crafted by early 20th century engineers is designed for a lifespan of 50 to 75 years. By the early 2000s, those lifetime. In April 2014, Flint, Michigan, makes a fateful decision to switch its water source from the Detroit system to the Flint River to cut costs. Almost immediately, residents report brown, foul-smelling, metallic water from their taps. City officials insist the water is safe. The Flint River water flows with a menacing undertone, its corrosive nature silently stripping lead from the city's aging pipes. For over a year, families, many low-income and Black, unknowingly bathe and drink in danger, while officials insist all is well. The truth festers beneath the surface, hidden from those who trust their leaders. By the time the crisis erupts into national news, the damage is done. Thousands of children in Flint have been poisoned, their futures clouded by lead exposure, a neurotoxin that wreaks havoc on brain development, learning, and behavior. There is no safe threshold for this. Independent researchers from Virginia Tech, alongside Dr. Mona Hanna-Attisha, a devoted pediatrician, rise as unlikely heroes. They shatter the silence, compelling the state to confront the truth of the contamination. Not the city government, nor the state environmental agency, but a dedicated university lab and a pediatrician step in to do what officials have refused. Flint becomes a symbol of neglect, but it is far from an isolated case. The nation hides a grim reality. Hundreds of thousands of water main breaks occur yearly, and between pipes laid down during Wilson's presidency still carry drinking water, corroding from within, cracking beneath city streets. Treated water leaks into the ground, never reaching the safety of a faucet. The very infrastructure built by early engineers remains buried in American soil. The chlorination process, pioneered by Dr. John Leal in Jersey City, stands as the backbone of water treatment worldwide. Their efforts did not merely save lives, they forged the foundation of a modern world. A world where filling a glass from the tap is an instinct, an act taken. Yet now, the future hangs in the balance. Will the next generation rise to honor the legacy of their predecessors, maintaining what was built, repairing what is breaking, or will they stand idly by as systems crumble underground? Will they allow the water to turn brown again, as cities once deemed death traps begin to earn their ominous names once more? The choice is stark, and the stakes are high. The legacy of clean water teeters on a precipice, waiting for those